On September 4, 2025, Health and Human Services Secretary Robert F. Kennedy Jr. faced an intense Senate Finance Committee hearing that turned into a fiery confrontation over his handling of U.S. health care and vaccine policy. What was meant to be a review of the administration's 2026 health care agenda quickly spiraled into a clash over his controversial decisions at the Centers for Disease Control and Prevention (CDC), his public messaging on vaccines, and his broader approach to public health governance. Senators from both parties grilled him on leadership upheaval, access to vaccines, and the erosion of scientific trust. The immediate spark for the Senate's fury was Kennedy's abrupt firing of CDC Director Susan Monarez, less than a month after she assumed her role. Monarez alleged she was dismissed for refusing to fire senior scientists and for resisting pressure to pre-approve recommendations from Kennedy's own advisory circle, some of whom hold openly skeptical views on mRNA vaccines. Kennedy defended the dismissal by framing it as a matter of trust, telling senators that Monarez herself admitted she was not a trustworthy person. But the firing triggered resignations from 4 top CDC officials and exposed deep divisions within the agency. Senators viewed this turmoil as a threat to the credibility and stability of America's foremost public health institution. At the heart of the hearing was Kennedy's sweeping overhaul of vaccine policy. Under his direction, HHS restricted COVID-19 vaccine eligibility, limiting access mainly to seniors and younger people with underlying conditions. Pharmacies and pediatricians warned this created confusion and left many families unable to access vaccines for healthy children. Kennedy also dismantled the CDC's Advisory Committee on Immunization Practices by firing all 17 voting members and replacing them with figures aligned with his skepticism about mRNA vaccines. He further slashed roughly $500 million in vaccine development funding, halting projects for COVID-19, RSV, and avian flu. These moves drew bipartisan criticism, with lawmakers arguing that Kennedy had weakened America's ability to prepare for future outbreaks. Throughout the hearing, senators accused Kennedy of undermining public trust in science. Democrats, including Elizabeth Warren and Raphael Warnock, charged that his rhetoric spread misinformation and eroded confidence in life-saving immunization programs. Some even called for his resignation. Republicans, though less vocal about his overall fitness, expressed alarm at restricted vaccine access and the gutting of scientific advisory structures. Senator Bill Cassidy, a physician, said he was troubled by Kennedy's approach, while Senator John Barrasso voiced concern that public health was being jeopardized in the name of political ideology. Kennedy's exchanges with lawmakers were combative and sometimes personal. He clashed with Senator Tina Smith after she questioned his claim linking antidepressants to school shootings, accusing her of making stuff up. In another tense exchange, he asked Senator Warnock whether he was complicit in assassination attempts on President Trump, shocking many in the chamber. Senator Ben Ray Lujan ridiculed Kennedy's questioning style as gibberish, before delivering his points slowly and pointedly. These moments underscored the hostility in the hearing room and highlighted Kennedy's confrontational style when challenged. Kennedy's handling of facts became a major flashpoint. When pressed on how many Americans had died of COVID-19, he appeared uncertain, saying, "Nobody really knows," despite widely accepted estimates of 1.2 million U.S. deaths. Lawmakers seized on this as evidence of his disregard for scientific consensus. Yet, in a surprising twist, Kennedy praised Operation Warp Speed and said former President Donald Trump deserved a Nobel Prize for it, even as he sought to dismantle the very mRNA vaccine infrastructure that program had built. This contradiction highlighted the complexity, and some would say inconsistency, of his views. The hearing also exposed broader questions about Kennedy's philosophy of governance. At one point, he admitted he would not always wait for scientific consensus before implementing policy. To critics, this was a chilling statement that revealed a willingness to base decisions on personal belief rather than evidence. Medical groups, including the American Medical Association, swiftly condemned his stance, warning that it endangered public confidence and would worsen America's vulnerability to disease. Editorial boards and scientific commentators described the atmosphere at HHS and CDC as chaotic, raising fears that America's public health leadership was losing its foundation. Beyond the hearing room, Kennedy's tenure has been marked by structural shifts that reinforce these concerns. His Make America Healthy Again commission released a report in May claiming chronic childhood diseases were linked to diet, vaccines, and over-medicalization. Many citations in the report were later found to be inaccurate or fabricated, further fueling doubts about the integrity of his work. He also ended U.S. contributions to Gavi, the Vaccine Alliance, demanding new demonstrations of safety before funding resumed. These policy decisions, combined with cuts to vaccine development, have sent ripples of concern through global health organizations and scientific circles. For senators, the September 4 hearing was not only about Kennedy's policies but also about the stability of the U.S. health care system. They warned that families are being left in confusion, with shifting vaccine guidelines, vanishing public trust, and resignations among key experts. Democrats accused Kennedy of being reckless, while Republicans cautioned that his approach could undermine America's preparedness for the next pandemic. Still, no clear legislative path to removing him was discussed, reflecting both the political complexity of confronting a high-profile cabinet member and the administration's firm support for his role. The hearing left several clear takeaways. There was rare bipartisan unity in criticizing Kennedy's decisions, particularly his restriction of vaccine access and dismissal of seasoned scientific advisors. His confrontational exchanges with senators reinforced concerns about his judgment and temperament. His willingness to act without scientific consensus deepened worries about evidence-based policy. And despite the uproar, no immediate steps were taken to curtail his authority, leaving the administration's health policy trajectory unchanged for now. In the broader picture, the clash underscored the fragile state of public trust in U.S. health institutions. Kennedy's defiance, combined with his skepticism of vaccines and his sweeping restructuring of the CDC, has created uncertainty both at home and abroad. For a country still grappling with the long shadow of COVID-19 and facing ongoing risks from influenza, RSV, and potential new pandemics, the hearing suggested that America's health care future is entering turbulent waters. Senators may not have removed Kennedy, but their unified criticism showed the stakes: a public health system caught between science, politics, and personal conviction, with consequences that could extend far beyond the walls of the Senate chamber.